Hi, I'm Dr. John Rothschild. One of the many questions that I get from patients are, well, can't you just pull the tooth, doc? It's cheaper, isn't it, if I just pull the tooth? Au contraire. If you start pulling teeth, then the other teeth move around. They can move forward, they can move backwards, they can move up, they can move down depending on where the tooth that you removed was. With this economy in such a flux, people are more apt to take the quick route and to have a tooth removed. But there are consequences with that. A lot of things can go wrong in less than a year. Maybe that little small hole that was in the tooth now has gotten bigger. It didn't hurt 6 months ago, but now it's starting to bother you a little bit, or there's a twinge, or maybe it is keeping you up at night. We have to be able to assess the situation with an x-ray and a clinical examination. Maybe that tooth, all it needs is just a simple filling, or maybe it needs a crown. But if the bacteria travels into the nerve, then the tooth can be infected. So when a tooth is infected, there are just a couple things that can happen. One, you can take the tooth out, or two, you can do a root canal. Once you get into that situation, it becomes more expensive. Yeah, I can remove the tooth, but what you have to do is you have to think of the consequences once again. What do we do if we remove the tooth? We have to fill in that space. So a lot of the alternatives for filling in that space is a crown, or a part of which is part of a bridge, or a partial denture, or an implant. And once you get into these situations, they can be significantly more expensive. The fees can be significantly more expensive. Your time can be more time-consuming, and so can the doctors. So the message here is, yes, we can remove the tooth, but there are consequences. The best thing that you can do is do not procrastinate. Get in to see me or a dentist as soon as possible so we can assess the situation. Thank you very much.